The National Authority for the Campaign Against Alcohol and Drug Abuse, that's NACADA, has unveiled a new community-based strategy to tackle addiction across the country. The new approach was officially launched at the Kenya Institute of Curriculum Development and was led by Interior Principal Secretary Raymond Omolo. Now, the initiative emphasizes grassroots involvement in identifying, preventing and supporting recovery from substance abuse. Mike Callow now reports.
The new strategy marks a significant shift from traditional rehabilitation models, and instead of relying solely on expensive, centralized rehab centers, the innovative framework emphasizes locally driven solutions right at the heart of our communities.
It is our expectation that the implementation of the framework will enhance service provision at the community level and that more persons requiring support will be reached.
From this day forward, we should choose to be the Good Samaritan, standing up, showing up, giving a helping hand, speaking about it.
Developed in collaboration with healthcare providers, civil society, and grassroots organizations, the framework focuses on 4 key pillars: prevention by reducing the appeal of drug use through school-based anti-graft programs and widespread public awareness campaigns; accessible treatment by expanding affordable, culturally sensitive rehabilitation centers nationwide to ensure treatment is within reach for all; justice reform, which will be achieved by diverting non-violent drug offenders from prison to rehabilitation centers and emphasizing recovery over punishment; and lastly, community ownership by empowering local leaders and grassroots organizations to identify and address drug use hotspots within their own neighborhoods. According to Professor John Muteti, Director of Research and Licensing at NACADA, Kenya currently faces a major rehabilitation gap. Over 1 million people are in urgent need of intervention for substance abuse. However, the country has only about 300 rehabilitation centers, and of these, just 30 are public facilities, which is a mere 10%. The vast majority, around 90%, are operated by private entities and NGOs. Worse still, most of these 300 centers are located in urban areas, leaving rural and marginalized communities with little to no access to rehabilitation services.
And so when we do now the community-based, and we set up in every community a framework where people can be rehabilitated from the communities, it will go a long way in solving this challenge.
We'll have a list of people doing outpatient, inpatient, the whole continuum of care in treatment and rehabilitation.
Interior PS Dr. Raymond Omolo has emphasized that addressing addiction is not just a health issue, it is a security priority. By reducing substance abuse, the initiative aims to lower crime rates and create a safer, more secure society for all.
Extremist networks like the Al-Shabaab find it easier to recruit young men who feel trapped by drug abuse and hopelessness. Security reports note that some counties have become hubs for hard drugs, with criminal gangs involved in the drug trade also being co-opted by the extremist groups.
On to